2 videos ago, I did something where I talked about having cataract surgery and how great that actually turned out to be. The day after, he said everything was good and they made an appointment for the next week. So the next week I go there on the 29th and he says everything's going great. We need to schedule your second surgery as soon as possible. The reason he wanted to do it as soon as possible is so that I didn't have to go through all the pre-testing again. Because everyone has to go through pre-testing when it's related to a healthcare kind of thing. So I had already seen my regular doctor and he'd done an EKG and some other testing. They had taken blood so they could run some tests. So we didn't want to have to go through that again. Sounded good to me. So the day after that, which was the 30th, I speak to the scheduling nurse and she schedules me for the 7th at 1 p.m. And immediately I'm a little bothered by that. The reason being, I know how it actually works for physicians. I've been in healthcare since 1983. And usually they like to do things earlier in the day because they're fresh. You know, that's what they get used to. They get used to waking up early, getting themselves into the office, getting themselves alert, sharp, and then they like that. It doesn't matter whether they're doing a long surgery or a bunch of short surgeries, which is what cataract surgery is. They like to do things earlier in the day. So 1 o'clock, I'm thinking, boy, I'm not necessarily sure I like that, but I don't have any choice. So they get me more eye drops to start putting in that eye, and I'm still putting eye drops in my right eye. And, you know, we're moving on. But over the weekend, I started having the spidey senses saying, you know what, something's going to go wrong. It's not going to be as smooth as it was with the right eye. I just had this feeling. And I got to tell you the truth, 85% to 95 or 90% of the time, I turn out to be right on that. So I wake up on December 7th early because the initial thing was that I thought I was going to have a morning thing and I didn't. I can't eat anything. Diabetic. They told me later on it's better if your glucose level is higher than lower. But no one told me that at the time. So I can't eat anything. I can drink some clear liquids if I want to, but not to overdo it. So I had a little bit of water and that's it. Around 10, I get a call from the office saying that they've got some kind of emergency going on there and asking me if I can come an hour later than I was scheduled. So, well, you know, what can I say? Yes, we'll do this thing. And now I'm thinking, okay, now we're not doing this until sometime after 2. And that now means that the physician's probably going to be in his either 7th hour or 6th hour. And he's going to be tired because he's done a lot of these. They really only take between 30 to 40 minutes most of the time. I don't know what the emergency is, so therefore that could have been something that was going to take a lot longer. But, you know, what are you going to do? So my friend Kelvin takes me there a little earlier. Well, you know, it's an hour later than it had been before, but I'm still there. I have to go in, and the processing was a little different because I didn't have to do everything I had to do the first time because it was still within a couple of weeks since I had the first surgery. And I'm laying there on the table, and I'm drowsy. I don't know why I was drowsy, but I was just really drowsy. And like I said, I just had this feeling things weren't going to go exactly the same way. It actually took longer than what the scheduled time was because they had to get someone else in there. Like I said, it was some kind of emergency, and that person actually took almost an hour. So there you go. Anyway, I'm chill. I'm laying there in the bed. They haven't given me any kind of anesthesia yet. I'm just kind of laying there. And eventually, you know, the anesthesiologist doctor comes in. He says his piece. My doc comes in, says, yep, we had to go a little overtime on the other person, but we're going to get you in there within 10 minutes. I said, okay, fine. I dozed off. I don't know why I dozed off, but I did. I just was so tired. So anyway, they come and get me. They put everything in. They do the anesthesia in the arm. And I get rolled into the room. And the procedure's going on. It was painless, thank goodness, but I could tell something felt different. I don't know why I knew something was different, but something felt different. But I stayed awake through the entire thing. They put the eye shield on me. They rolled me out. And this was odd because they had me stay in there a little longer than I did the first time. I don't know. So anyhow, everything seems kind of good. The eye doesn't necessarily feel perfect. Like I said, I've got a shield on my eye so I can't see anything, but it just doesn't feel real perfect. Anyway, my friend comes, gets me, drives me home. I get in the house and I have an appointment the next morning at 8. So same rules apply. I can only eat up to a certain point. I can't have anything to drink in the morning. But, I'm good. So the next morning, I, wake up. My friend comes and gets me. He takes me to see the doctor. We get there early because I knew he would already be there. So I got to see him early. I was in there maybe 5 or 6 minutes. But this was weird because the nurse is the one who took the eye shield off. And as soon as you took the eye shield off, my eye was burning. It burned and the lights were way bright. And I was like, oh my God, oh goodness. And I closed my eyes and she said, oh, let me turn some of these lights down. But the light in the hallway was bright. So she had to close the door to kind of turn that down. So she put up the thing saying, okay, can you read the top line? I said, I can barely read the top line. And I told her the letters. She said, well, that's the second line. I said, I can't see a thing. So she gives me this thing that you hold in your hand. It's got little holes in it. She says, this might help you to focus on something. So holding this thing to my eye, I could read the second line. I couldn't read all the letters on the third line. And she says, well, that's okay. That happens sometimes. So what she said is your eye is still swollen and it's also dilated. So that happens on occasion. You should be fine. So she leaves. A couple minutes later, the doctor comes in. I said, yeah, this isn't working as well as it did the first time. He says, well, sometimes those kind of things happen. He looks at it. He says, but, the sutures were fine. Everything should be good. You will probably be better in a few hours. Just remember to take your eye drops. So there you go. They give me these little cheap things that they said sunglasses, little plastic things that you can bend in your eyes, bend in your hands or whatever. I put that on because even though it was overcast outside, that was really bright. And I just didn't want to keep one eye closed. I put those on and it was a totally different experience than the first time. So I get home, my friend, leaves. I come to the computer and it was bright. I hadn't touched any of the settings, since beforehand. Actually, I dimmed it a little bit for the right eye, but this time I had to dim it even more. I couldn't see anything. Luckily, I had already bought my readers from this first surgery, and that was interesting because even though I couldn't read letters or anything, I could actually still see better than I could without having the surgery. So in this particular case, I could put that on. I could now read the phone. I could read the tablet with both eyes open. And that turned out to be kind of an interesting thing, but I needed another nap. I was still groggy. I still have no idea where that came from. I wasn't sick. I had no fever or anything like that. But for the entire day, my eye still hurt. It still burned in the light. Probably around 8:30 or 9 at night, I got used to the light a little better. So that was thankful. And I still went to bed early. I'm not a guy who goes to bed early. Usually I go to bed between 11 and 12, but I don't usually shut everything off until midnight. The next day I woke up and I'm like, oh, the eye feels good. I can see everything perfect. No real problem there. Okay. So that means the swelling went down. The eye wasn't dilated anymore. Everything was fine. However, just to mention this, the right eye had started to scratch a little bit, and I did some research and I talked to the doctor about it, and they said it could be anywhere from 4 to 6 weeks before you're fully healed. So at least I knew that was okay. I had a feeling. He told me that for the right eye, if I had any more eye drops still left, continue to take those, and for the left eye, keep taking those eye drops because I'll have another visit with them on next week, either Wednesday or Thursday. And, that'd be the first question they'll ask, are you still taking your eye drops? I said, yeah, I got that. Got the eye drops. These are the ones for the right eye. I will continue taking that. But it's a much better world being able to see. I don't have any real gripes. Like I said, I expected something wasn't going to go right with the left eye, and I was correct. And the only thing that I have problems with, and this is just a mental thing, I've been wearing glasses since I was 8 years old, so I'm talking about over 50 years, is the fact that every once in a while, when I set the phone down or set the tablet down, I reach up to take glasses off that I'm not wearing. That's the strangest thing. But, that's going to be something I'll probably do for a while. I bet that happens to other people also. Anyway, that's it. That's the story about the second surgery that I knew, I just knew in my mind it wasn't going to be as good as the first time. But after a couple of days, I'm fine. I can see well. Probably sometime next week, I might start feeling that little bit of scratching that I felt with the right eye after a week. But they say that's normal. You check the internet, it says that's normal thing for 4 to 6 weeks at least. We're good. So anyway, that's what I've got. Way shorter than the first video. But I just wanted to mention that if you're ever going to have any kind of surgery whatsoever, see if you can get it as early as possible. That's just something that everybody needs to ask for. And there you go. My name's Mitch Mitchell. Let me know your thoughts. And if you have the wherewithal to see the first video from a couple of weeks ago, just know that I gave timestamps. You can jump around because that one turned out to be more than 30 minutes, which I didn't expect. Y'all take care.